1:05 here, and we're going to go ahead and get started without further ado. We want to welcome you. I'm the Reverend Shonda Nicole Gladden. I'm the CEO of Good to the Soul, and you are here in this virtual forum in a space that is prepared and made possible by a partnership by a few different entities here in Indianapolis. Want to make certain to share with you. Yes, if you can use the chat, we can certainly provide additional information through the chat. So we thank you for utilizing that feature. Each of you will be muted at this time, but don't worry, you will have an opportunity to share in dialogue. We have some small groups planned. We have lots and lots of opportunities. But today's virtual forum is made possible through a partnership between the Monon Collaborative, Good to the Soul, as well as the Ministerium. And so this morning, we're going to share in the agenda as outlined before you on the screen. Hopefully you can see the agenda. Thumbs up if you can see the agenda in front of you. Outstanding. So again, I'm going to open us with centering moments. I want to invite you to center yourself, calling upon the divine, however you understand that divine to be. Good to the soul, we believe in the spirit of universal living. And so while I'm a Protestant tradition clergy woman, I understand that that is not the only way that the God of the universe has come and to be responsive to humankind and to all of creation. So center yourself where you find yourself, that we may begin this time together. With intention and with purpose. Holy and righteous, one who breathed breath of life into all that is. You who animate and energize and give life, health, and strength to all that is. We invite you into this virtual space to have your way, to move through the technology, to move through the participants, to be present in this space as only you can. And as we share together, we will acknowledge that we are not alone as we continue to consider how we can be most healthy individually. We invite you to show us how we can corporately attend to the health and well-being of one another. Be present in this space and in the spaces to come as we thank you in advance for all that we will experience together. These things we share together corporately as humans, as co-creators, as people to whom we have sent one to another. These things I pray in the name of my Redeemer, Jesus, and we lift it to the God of the ancestors and this God of the spirit of the universe. And always and in all things we say, thank you, Ashe, and Amen. So you will see before you that we have just a few agenda items, and Michael, it looks like, is ready to share his screen. So I'm going to give permission to have him share his screen, and that way you can see what he's got cooking for you. Outstanding. So I want to give an overview. What is this about? This is a conversation. It's a community conversation. On February the 29th, we had something together at the Flanner House here in Indianapolis, where we invited lots of community partners, leaders of faith organizations, clergy, pastors, imams, rabbis, all kinds of folks were invited to come and to begin a conversation around what does health and wellness look like in your community. And we're going to continue this conversation today in a virtual way, though. And so this allows us to open up the space to more people, but it also allows us to really see how can we be community in light of sheltering in place. So today, while this is not specifically about COVID-19, I know a lot of us are experiencing COVID fatigue, that hearing about it and talking about it every single moment of our days and just being a part of the reality of what it's like to shelter in place, it may be a bit too much. So if you're feeling that way, do not feel obligated to talk about COVID-19 at all. As a matter of fact, I won't even say the disease that has a surname anymore, and as much as I can try, I'm knocking on wood. But today, this is about how do we have conversations around public health, equity, and access, and ways that we can act upon the information that we receive. So we're going to get into this conversation by having a brief public health and wellness introduction by sharing together a video. Michael, are we ready to launch that video?
Hello, and welcome to this video where we're going to talk about public health. Public health has made a significant impact on the health of populations, making people healthy and saving lives. For example, in the United States, between 1900 to 1999, people's life expectancy has increased by over 30 years. Did you know that 25 of these extra years gained are due to public health interventions? So in this video, we're going to take a look at what public health is, how it's different to clinical medicine, who's responsible for doing it, and how it's done. First of all, let's have a look at what health is. The World Health Organization defines health as a state of complete physical, mental, and social well-being, rather than a mere absence of disease or infirmity. This is a pretty bold and ambitious definition that prompts people to look beyond diseases and focus not only on the physical aspect of health, but also on the mental and social aspects as well. And public health? Well, public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. Okay, so how is it different to clinical medicine? Let's take a look at an example. Let's say someone has an accident and has a broken leg. A clinician's main focus is the immediate health problem, fixing the fractured leg. Clinicians focus on the individual. The public health approach would be holistic and would focus on figuring out how and why this person had an accident, so that actions can be taken to prevent it from happening again. For example, why did he have the accident? Was there a problem with his vision? Was it poor knowledge of driving skills or bad attitudes towards driving? Was he under the influence of alcohol or drugs when he was driving? Are there laws against this and resources to enforce it? What are the community expectations or attitudes towards driving? Does he have a good social support network that will help in his recovery or prevent this from happening again? Was the road he was driving on safe? Was he driving a safe car that was well maintained? If not, why not? Could he not afford it? If not, why could he not afford it? Does he have a job that doesn't pay well? Why is that? Is it because he did not have access to good education? Was there good access to health services which would determine his treatment and recovery? As you can see from this example, health is determined by a complex interaction between many different factors or determinants of health. These include individual characteristics, lifestyle and behaviors, and also the physical, social, and economic environments, the social determinants of health. In order to make a difference in health, there's action needed across all the different determinants. Public health focuses on these upstream factors to make changes that can benefit the health of the population as a whole. This seems like a very broad and complex task, doesn't it? So, who's responsible for public health? Ultimately, the responsibility of creating a healthy community rests with all sectors of society. Health departments do have a central role in public health. However, improving the health of a population requires the coordinated efforts of a broad range of stakeholders. This includes other areas of government, the private sector, non-governmental organizations, international organizations, and communities, to name a few, all united with a shared goal of improving the health of the public. Now let's have a look at how public health works. The World Federation of Public Health Associations has developed a useful framework to understand how public health is delivered. There are 3 core service areas of public health and a group of enablers that ensure that these services can occur effectively and efficiently. The 3 core areas of public health are protection, promotion, and prevention. Protection is about protecting the health of the population. This includes the control of infectious diseases, managing environmental hazards, ensuring a healthy workplace, and managing health emergencies. Promotion is about improving the health of the population. It covers a broad range of activities that not only focuses on the individual, like promoting health behaviors over a life course, it also focuses on improving the social determinants of health. Prevention is about preventing health issues before they occur. It includes activities such as vaccination and screening. To enable these core areas to function, there needs to be good governance, advocacy to influence and obtain support and commitment for actions that support a health goal, Capacity, having an adequate, well-trained and supported public health workforce. And having accurate, timely information to support health actions such as relevant research, surveillance, monitoring, and evaluation. So that's a quick introduction to the fascinating field of public health. We've had a look at what it is, how it's different to clinical medicine, who's responsible for doing it, and how it's done.
So just before we jump into hearing from Representative John Bartlett, I'm curious, how many of you had already had experiences with public health? You should see before you a poll where we're inviting you to respond to this question. Do you see a poll in front of you? If so, go ahead and answer that question, and then we'll hear from Representative John Bartlett. We're about 70% completed with the poll. So if the few more of you will just go ahead and answer, we'll close it up. We're at 80% and we're going to close it if we don't hear from you. Okay, there you go. It looks like we just have 2 more friends to respond. And here we are. I'm going to end the poll. And so before you should see where we all are. This is how we're coming into the space. So no one here, well, one person here is an expert, but we want to encourage you that we are not coming to this space as experts. Maybe some of us are coming as professionals, and maybe some of us are just having read some articles about public health. But by the time you leave today, we do hope that you will have more information, that you will be armed with information, and you will begin to have additional capacity. And to get us there, with those 4 points being raised in terms of what it looks like to be in optimal public health, we thought we'd start with governance. And so we're elated and excited to have with us Representative John Bartlett, who is the state representative to the Indiana House District 95, who was elected in 2008 to the Indiana House of Representatives. As a lifelong resident of Indianapolis, Mr. Bartlett, Representative Bartlett, is really someone who's committed to the health and well-being of our state, and especially within Indianapolis. And so, Representative Bartlett, if you can let us hear your voice, I'll turn it over to you.
Can you hear me?
Yes, we can. Outstanding. You have the floor. Very
good. And thank you, Reverend Gladden, for walking me through this, because I'm certainly IT challenged, but you were able to get it done. But greetings to all this morning from the General Assembly of the great state of Indiana. I know this is a tough time for all of us, and this is a good forum for actually a Saturday afternoon so that we can discuss our public health. And I think the 2 areas that I would like to address is, since I'm not a medical doctor, is the social piece and also the mental health piece. Social health is extremely important because this thing, COVID, is real. It's truly real. I had a cousin and his wife to go to the hospital with COVID-19. He's now in rehab. She didn't make it. So my niece had COVID-19. She was in the hospital for about almost 4 weeks. She's home now, but on oxygen. So this thing is not something to play with. And I'm going to stick my neck out there a little bit. They were saying close down the country, close down the country. Then they said 70% of the folk dying were Black folk. And then they said, open it up, open it up. So I question opening it up so soon as well. But when all this is over, and even during this time, mental health is a key piece. And it seems like here in the state of Indiana, across the nation, we always want to sweep mental health under the rug. And that's just not a good situation. Mental health is a major piece of our society. And a lot of things happen because of mental health. Our criminal justice system is escalated as it is because of mental health. Now, with COVID, people are cooped up in the house, and if you are in an abusive situation with your mate, then the stress will increase that. We have things in place by law. If you are a teacher and a child comes to school and shows signs of abuse, you must report it by law. Well, children are not going to school now, so there's a lot of abuse going on with our babies right now that's going to need to be addressed after all this is over. Over and above that, I believe the suicide rate is up across the state of Indiana right now. And I did ask in a telephone conference, Zoom conference earlier, what are we doing to protect or to put things in place to protect those when we come out of this COVID, for them to get mental health help? And no one, as I said before, want to talk about that, but it's very prevalent. You have small business owners who the business was handed down from their parents. So the people who work for them, they know their parents, their grandparents, their children, and not being able to pay them while this thing is going on, they take it personal. And then for them, that's all they knew, is to work and make money and take care of their family and take care of other families. They're not able to do that. And things will affect them differently. So we need to notice that. And if you have friends that you think are a little different than what they ordinarily are, talk to them about getting mental health help. And it's not an embarrassment. Mental health illness is just like a physical illness. And so we need to be mindful of those things. So that's my spiel this morning. And congratulations to all the citizens of the great state of Indiana. Congratulations to you, Pastor Gladden, for bringing this together and for looking out for Hoosiers. And I thank you.
And we thank you again for being present and being available to us. We deeply appreciate the ways that you are attentive to the ways that public health is important to us here in Indiana, and your work as a member of governance, as a member of the legislative world around us. We appreciate you. So thank you. We're going to continue though. Again, governance is one piece, but advocacy is another piece. And so we have pastors who are concerned about advocacy. And so we're going to hear from Reverend Dr. Ivan Douglas Hicks, who represents the ministerium at this time, around what does advocacy look like from a pastoral perspective.
Thank you, Reverend Shonda Gladden, for the invitation to be with you on today, and for 5, 6, 7 minutes to talk about the ministerium and to go through 5 or 6 slides here. So I don't know who's handling slides. Do I have an opportunity? Oh, Michael, my man, there you are. Appreciate you, brother. So we're going to go through these rather quickly on today. Maybe not quite that quick, but right. And so we're an organization that vanguards the causes of widows and children. We believe that that's the mantle of the prophet. We're an organization that began maybe a couple of years ago specifically to look at social justice advocacy and to see how we as a faith community, many of us pastors that got together, Michael, the 4 of us got together, and that's not Starbucks. I think we went to a Starbucks after we went to School 42 one day and determined that we're doing a whole bunch of wonderful, great stuff, but let's come together and do what the prophets of old did, which was they vanguarded the causes of widows and children. And so from there we said, look, the legal legacy can be our arena, because that's where we see documentation of change take place. It may take place in many other ways, but documentation of change takes place in public policy shifts. And so we got together, and Michael, we moved on to our first faith community consultation took place on in February, somewhere at the top of that. It tells us the exact date. And so we were able to get together with a number of people, community advocates, educational advocates specifically, because our thought was, or presupposition was, that educational equity would be where we would begin. And so we pulled the faith community together. On the next slide, you'll see, well, at the bottom of that slide, you may even see that there were a number of clergy persons that came together for an opportunity, as well as persons from the United Way, from the United Negro College Fund, from other educational advocacy organizations that gave us a framework as a faith community on how we could move and how we should move, once again, specifically at the state legislature, which may be the next slide. And so we began after that faith community consultation, we began to fight Senate Bill 279. Our presupposition and why we started at the United Way for that faith community consultation was that we would work in early childhood education, and that we would specifically deal with pre-K and trying to move that towards statewide or universal. And so Dr. Gwen Kelly from the Children's Policy and Law Initiative was among the educational advocates that presented in that first February meeting that the ministerium had. We latched on to what she presented, which was 279, which was seeking to take 12 and 13-year-olds to jail, as and with adults. And so we fought that effectively. You see even that bad bill poster on the left has John Bartlett on. So he was early on with us fighting to make sure that 12 and 13-year-olds didn't go to jail. They brought it back up again this year. 449, they called it this year, as opposed to just taking kids to jail for attempted murder. They tacked on 10 other charges. And Houchins, Senator Houchins presented the bill for a second year that really dug down, leaned into the heinous nature of what they were seeking to do. And so we fought it effectively, I believe, for a couple of years. But not only, Michael, do we look at those things that are hurting our children, and it may be a reactionary law, we seek to make policy shifts and changes. But as we went to the Urban League this year for our, in October, for our second faith community consultation, we determined that if we're going to fight for our children, that there are other issues that we need to make sure we're looking at. And so then there are now 4 issues. These 4 issues are priorities that came out of our second faith community consultation, things that we would work on that specifically dealt with women and children, women's and children's issues. But as well, these are things that were in play and will continue to be in play and continue to be priorities right now at the state legislature that deal with children. So sort of the way we funneled and determined that these are the things we would deal with. The bottom 2 things that you see are follow up to our comprehensive juvenile justice. We need to have reform in that way. We need to make sure that we create positively, proactively juvenile justice that makes sense and looks at what's taking place around the country and what we as leaders can produce, as well as with early childhood education, which is number 4. And so then specifically the health issues that are germane to what we're talking about today are mom and infant mortality and lead poisoning. There's legislation before the state General Assembly right now that will deal with these things and has dealt with these things. And so the ministerium is keying in on these things and making sure that we as a faith community create the faith infusion, do the thing the faith community can do in all of these areas, because we don't necessarily have to lead any of it, but we determine how we can make a difference as a faith community, and we're working effectively in all of these areas. And so there's another slide, right, that talks about what we're doing right now, so that while we're at the state legislature right now during these intra-corona times, I'm calling them, right now, there's some right now needs that we have. We're dealing with food. That flyer on the right shows you that we are at this point somewhere in between 500 and 750 families a day are affected or impacted by the food that we're passing out, distributing in partnership, not just with Indigo and their buses, but with the health department to ensure that we are employing best practices and the appropriate protocols that we help them establish for what we're seeking to do, because we're going to feed people. And so now we have partnership from highest level and somebody assigned to us to make sure that we're doing this in a hygienical way. We're dealing with food, passing out clothing as well, have that moving. And now we're looking toward a technology drive that will have the tech community of Indianapolis, Indiana scrub and repurpose laptops for children so they can go to school. And so I don't know if there's another slide. How many? There's another slide. And it's coming. Did I pass my time? Yes, there we go. So anybody that wants to get a PhD in this, African-American face and community transformation, you can earn your PhD. And there's a fellowship available so that you can get scholarship and a stipend to go along with one person that will be admitted, and the application has to be in by the 15th, as we seek to fractal or replicate what we are doing elsewhere, because there are those that are attracted then as well. We want to make sure that we're creating the next generation. Is there another slide? Thank you. What time is it?
Thank you, Dr. Hicks. You were just so hair over your time, but it's all right. We are in good time. And so, friends, you've been with us and you've heard from governance, you've heard from advocacy. And just before we jump into our next go around, we really want to know, how interested are you in being present to these kinds of conversations? Is this increasing your public health awareness interesting to you? First, before we get to the survey, let us go ahead and take a look at the poll that's in front of you. And you have about 50 seconds to answer the poll that should be in front of you.
Not yet.
You don't have a poll in front of you? We're going to turn your mic off too. I think we still have you unmuted. Sorry about that. And we have about 3 more friends who need to complete that poll. And if you'll do so, we will close the poll. We're going to give you about 10 more seconds. 8, 7, 6, 5, 4, 3, 2. Sorry if you didn't get a chance to complete it. Take a look here. Who in the room is looking forward to this? Yay! We've got one person says, all I ever really wanted to do was learn more about public health. Well, this is the space for you, because you're definitely going to learn today. As one of the great comedians would say, you're going to learn today. But in all sincerity, we want to learn from you before we share more knowledge with you. So if you'll pull out your handy dandy smartphone, and hopefully you have the QR code reader, but if not, we've got stuff for you too. Brother Michael, can we put that survey up? If you'll turn your camera on and point it to the screen, it should take you to do a little survey. If that doesn't work, you can hit that link that's in the chat, the bit.ly link that'll take you to a survey. Once you complete that survey, we'll be ready to round it out. But we're going to give you some survey completion music in the background while you're doing the thing. Let's hear from you, how we can learn from you. You can copy the survey, plug it into your browser, or you can hold up your phone to the Was the music too loud? Well, we didn't need to pump up the volume. They would say the music ain't loud enough, but apparently the music was more than loud enough. If you're finished the survey, there's another poll in front of you so we can glean who's in the room before we transition to our next piece. If you're not finished the survey, no rush. Keep doing the survey. We just want to make sure we give everyone an opportunity to have something to do, that there's no downtime during this time together. And if you're watching online, we want to invite you, if you're watching the replay or if you're watching somewhere online at this time, we want to invite you that we can hear from you as well. The survey link is available on our Facebook page as well as on our website, as well as we can, if you've registered, you'll get it in an email too as part of our post-experience conversation. But we're going to give you about 60 more seconds. And we're going to close the poll, we're going to close the survey, and then we're going to move on to our next aspect of our virtual forum. You also have the ability to scroll down on the bottom of your screen if you'll just move your cursor on the bottom. And if you'd like to give a thumbs up or you'd like to clap your hands and let us know how we're doing, we'd appreciate hearing from you with some reactions on the screen. Promise you in just a moment, we're going to be able to hear your voice too. Transition now that we're going to close the poll that's in front of us. If you've not had a chance to let us know what kind of participant you are, please go ahead and try to do that. And we're now going to transition and welcome on to the screen a brief conversation about health data and you. We're going to welcome our partners from CTSI. We have Doctors David Craig, Dr. Carrie Lawrence, as well as Dr. Sarah Weehee. We're trying to make sure everyone is unmuted. I don't know who's going to represent the team, but we'll make sure all of you have the ability to speak if you so desire. You should have that opportunity now. Let's hear your voice.
Thank you, Reverend Gladden. This is David Craig. I'm going to be leading off, and then Sarah Weehee's going to be stepping in as we go forward. So first of all, thank you so much for setting the tone here and being so inclusive and generative and creating good vibes virtually. Appreciate you. So my role here is to just introduce the Monon Collaborative and importantly to extend an invitation to continue this dialogue into a learning community. So Michael, if you can move to the next slide, that'd be great. This is very brief background. The Monon Collaborative is created by Indiana Clinical and Translational Sciences Institute. I like this logo here because the idea is community and neighborhood organizations have the expertise, the relationships, doing the work out there in the community. And then the question is, what might that look like to have foundational researchers who do data and qualitative work come alongside and have dialogues on health and wellness in our community, looking to support community impact hubs as well. So we're really grateful to be working with Good to the Soul, Reverend Gladden, and all of the soul stirrers who are here. And conclude here with an invite to and lay health advocates to join a health and wellness learning community. So if you could just skip forward to the next slide. These are the people. Sarah Weehee may have been the person who listed public health professional on the survey. Maybe Dr. Lawrence is the person who said public health expert, because they certainly qualified for that. David Craig, I'm from the Religious Studies Department at Liberal Arts, so I've read about public health, like most of you. And I tend to be a text person too as a professor. I want to just quickly a little bit of my journey for why I have passion around this community work and thinking about health and wellness. So Michael, if you could go to the next slide. This comes from an interview study I did a decade ago where I was doing interviews at Jewish and Catholic hospital organizations. The nun I interviewed said to me, really opened my eyes. And I think everybody's eyes are already open here on this session. But she said this to me. She said, you can bring a kid into our emergency room with pneumonia, not a problem. And of course, this resonates very strongly today. You can have that kid back on her feet all fixed up and she goes back to an apartment with no heat. Are we healthcare providers? No. I mean, who's responsible? And what they did, this hospital organization, they built community stakeholder coalitions. They went out into the community and said, who's doing the work? Who knows about community health priorities? Who understands the lay of the land? Let's bring people together and create coalitions to advise us. And I love this phrase that she used. She said, wellness are about the between and the connect. We oftentimes reduce health to going to certain services or maybe accessing social services, but so much of health happens between, right? In the relationships we have, the families we live in, the space where we exist. And so the question becomes, well, how do you make connect and who's making the connection? And so much of the time, Michael, if you could skip to the next slide, it's congregations, it's houses who are doing this kind of work. So this is a term, religious health assets, that actually comes out of a group in South Africa, but they were very interested in all the ways that religious groups support health. And so that can be the tangible health assets, buildings, programs that people engage in, financial assistance, the work that the ministerium's doing, delivering food door to door, right? These are crucial aspects of religious health assets. But there's also that intangible spiritual connection that happens in religious communities, and trust and prayer, meditation, singing, connection. All of these things are intangible. And I'm sure they are sorely missed right now, right? Because people aren't able to gather. We have kicked off Ramadan, the holy month in Islam, where people gather nightly in mosques, and that's all disrupted. So I know everyone's feeling the loss there of that kind of connection. So these are two really important ideas for me in terms of how I've gotten passionate about thinking about health and wellness and how congregations support it on an ongoing basis. If you could just skip to the next slide. So a little bit of background. In 2019, I was lucky to work with Pastor Hicks and Andrew Green at Shepherd Community Center, so First Baptist Church, North Indianapolis on the west side, Shepherd Community on the east side, and we did a study together about the Healthy Indiana Plan. Next slide, please. Listening to firsthand users of the Healthy Indiana Plan, which is Indiana's Medicaid expansion, there was so much wisdom shared and all of this experience about what works and what doesn't work. So this is the kind of thing that can come out of that community engaged work, is lived knowledge, local experience, personal wisdom about all of the things that we see from the system level. You could skip to the next slide too. Thinking about health and wellness, these are the things that people mention: transportation, food deserts. But interestingly for me, the next ones were mental health, stress, stigma. These are very much alive right now during the current crisis. And in some sense, the crisis has pulled this back, even though people in the community know about all of these things already. And if you could just go to the next slide, please. So what did people say made a difference in terms of accessing the Healthy Indiana Plan and staying healthy? Person-to-person support. This happens every day out of the work of houses of faith, congregations. Organizational relationships are vital. people being connected to organizations where they have trust, where relationships are established. It's not just hiding people connection to services, but knowing what's going on in people's lives. What is their social network? All of these things come out when relationships are built out of these organizations and community. Finally, spiritual connection and community support holistic health. One of my favorite lines from this study was a woman who described First Baptist Church North Indianapolis as a spiritual hospital. Right, this is a spiritual hospital. And so the thought, go to the last slide, Michael. Sorry, one more. The thought is, in addition to a community forum like this, what would it look like to go on a journey together? I like to think about health and wellness in terms of covenant, because it really is about a journey together, and it's also about communities coming together. And so that's basically the learning community, is to sort of covenant with each other for 7 months of learning and dialoguing together. And we're inviting, hoping, seeking a dozen clergy or lay health advocates to create a space that allows the work that's already being done in the community in support of health and wellness to expand, but also to seek some new connections. And these are some of the goals we imagine coming out of this, but the goals are going to be set by participants. But sharing ongoing congregational programs and neighborhood outreach, gathering and stewarding information and resources out to congregants and neighbors, collaborating and identifying and acting on community health priorities. That's a key component here, to building on like the work that the ministerium's already doing, right? The ministerium has identified those priorities. Challenging status quo operations and building on existing capacity to broader interfaith health network. So that's what I wanted to share, and really just extend an invitation to people who would be interested in continuing to come together and dialoguing and seeing what comes up as people talk together, community side, but also on the university side, so that there's that mutual informing of each other to see what might grow. Carrie, did you want to add anything?
I was going to say, no, I think that you covered everything, that captured it, our kind of intention well. And I think it, just to reiterate that we're really seeking for the voices of the people to inform how this evolves over time.
Okay. Can everybody hear me?
Yes, we can.
Okay, perfect. So I didn't have slides. I was just going to walk through some links, and if I can have permission to share my slides, then, or excuse me, my desktop, I can do it. Or I also put the series of links in the chat box, which I thought, if folks wanted to copy or use in the future as resources, they could as well. Whatever works better, Michael.
Yeah, so let's see if, I don't know if Michael is still able to hear you or speak to you, but it looks like he has there are a bunch of links there happening in the chat. So let's see, without your slides, how can we give you access to the ability to, I don't know, let's see, let's get Michael back in the room so we can hear from him directly. Michael, are you there?
All right, there we are. I was muted.
Yeah.
So here's what I will do. I am putting the I'm going to pull up the ArcGIS link first.
Perfect. And I'm just going to walk through some of these you guys might be familiar with, but just briefly, my name is Sarah Weehee. I'm a pediatrician, and I do public health research. My passion is relating to health health justice and health equity issues. And I am particularly passionate about leveraging data and stories to combat injustice. And so I think it's very empowering to have access to the data yourself. And so I was going to try and orient folks to a couple of the resources available online and talk briefly about this Indiana Pandemic Information Collaborative that I participate in, and I co-lead sort of the community work group as part of that with Jackie Dowd from the Lilly Endowment, and would just be very interested in participation from this group in terms of what data, what information, what outreach efforts would you think be helpful in this arena. So to start, if we could go to the first link, Michael, this is probably the most famous and popular and
looking for?
Yes, thank you. I don't know if you can
Zoom in on Indiana.
make there's like another panel, I think, over to the side. I think it just depends on maybe the way it's shown here, but we don't need to spend a whole lot of time on this. I just wanted to point out that, oh wait, I'm sorry, this is, could you go back? There's another ArcGIS one. Yeah, there we go.
Okay, this one, it looks like it's having some difficulty loading.
Okay, well, I can just talk through it, and then if folks want to go to this slide a little bit later, then you can. So the Johns Hopkins one, which is the one that's not loading at the moment, and it may be because it is receiving quite a bit of traffic.
Yeah.
Shows both national and international numbers as it relates to coronavirus. The cases, tested, and deaths, just as the Polis Center does here for the state of Indiana. They do go into quite a bit of detail, but I think it's really helpful to see how Indiana is doing within the United States and how the United States is doing compared to other countries. But I was just going to touch on that briefly because I thought folks would be much more interested in the state level resources and Marion County in particular. So the next one is from ISDH. Michael, if you go to that second tab. Thank you. And this is one that you all may have seen if you've been tuning in to the governor's press conferences daily at 2:30. He's been highlighting this as a resource, and it has changed over time and I think improved quite a bit by adding demographics and some other important factors that I think they heard loud and clear were of interest and importance to the community. So yeah, thank you, Michael. If you scroll down, you'll see that every day they post the new positive cases, the new deaths, and new tests. That's in the last 24 hours or since the last time they had updated this link. And you can see as of today, there's 785 deaths due to coronavirus in Indiana, according to the Indiana State Department of Health. Now, I wanted to mention that these are just the tests and test results that are reported to ISDH, and it is voluntary that various agencies report these data to ISDH. So this is likely an underestimate of the total number in terms of disease burden in our state. And it's pretty significant, as you all know. I'm sure I'm not telling you anything you don't already know. But yeah, thank you, Michael. You're zooming right in where I want to be, which is how those vary by demographics. And this is some of the data that has gotten remarkably better in the last couple of days because surprisingly, or maybe not surprisingly to some of you, they did not even ask this question on like the standard test kit data collection form. So they had to get this information by linking it to other data sources, which is why they didn't have it immediately. And it took some time to really get the information that we really needed to see the disparities that we're seeing really across the country. And Indiana is certainly no exception. So if you scroll up just a tiny bit, Michael, and click on Marion County on the state level map, you'll notice, which is the dark one there. Yep, exactly. Click on that. You'll notice that all the numbers change. And so I wanted to highlight that this site is really nice because you can apply what they call these filters and zoom in and get the data specifically to Marion County, which I think is nice. So right now that filter is applied because Michael clicked on the Marion County there, and if you scroll down a little bit more, you'll see that the demographics have changed considerably. So here it's saying, for example, and this is, you know, not surprising again, because there's different demographics according to, you know, who is living in our state. But this is something that I think, again, knowledge is power, data are power. If you can go there and sort of click around, I think that this is really valuable. Okay, so if we go to the, excuse me, I'm sorry, before you go to the next one, if you scroll down just a little bit further down. Okay, I just wanted to point out one other thing, which is the ICU bed usage and ventilator usage. Many of you may have been following this in the news, but one of the primary causes of death initially that they were very concerned about was relating to what they were calling the surge. And that was where the cases were really outpacing the amount of resources we had as a state to take care of people, and particularly the number of ICU beds and ventilators. So when you see sort of these data that are focused on ICU bed usage and ventilator usage, that's what that's really getting at, because for many people, they are in need of these support services to keep them alive and get them through the illness. If you don't have that available, you're in trouble, right? So thankfully, here in Indiana, we were able to keep pace and like convert beds. I was a part of a lot of discussions, for example, with IU Health, where they were very creative about switching over their neonatal intensive care unit at Methodist to adult beds, you know, so going from tiny little neonates to like adult ICU beds to be able to accommodate this surge. And since we're now past what they think is perhaps the peak of cases, depending on sort of how social distancing goes, I believe here, at least in the state of Indiana, we will continue to be below that capacity leverage. But I wanted to point out that because I think that it sometimes creates some confusion in the community, you know, depending on how in-depth the reporting is. So, okay. And then in the next, I think that one is the same one. If you go to the next tab, okay. So there's a series of dashboards that the Polis Center, which is an affiliated institution with IUPUI, they've put together, which is really nice. So they've taken a lot of what the Hopkins site, that first site that I showed you, and sort of curated it for Indiana. So they have a case tracker, and the thing that they added here that I think is really important, if you see across the bottom along the map, it says cases per 100,000 people, tests per 100,000 people, deaths per 100,000 people. You can get at sort of how disproportionately coronavirus is affecting different areas by clicking on those tabs and sort of seeing how things go. So if you click on the case fatality rate, the last tab there on the, yep, thank you. You were doing an outstanding job, Michael. Thank you, reading my mind where these things are. This is sort of where, among the individuals who have been diagnosed with coronavirus, the proportion who have died. So some will be asking like, well, why is that? Well, that might be for a variety of reasons, such as access to care, comorbidities, differences in sort of the demographics within the state. But you'll see that it is not equal across the state, meaning a higher proportion of people are dying of coronavirus, assuming you've been diagnosed with that in different places across the state. There's some other Polis Center. I don't know if you can click on the one that says the risk factors over in the chat, because I'm not sure you pulled it up yet. Yeah, so there's the Indiana cases track under the Polis Center. There's 3 different links.
Do you want the savvy.org?
It's iu.maps.arcgis.com. It says Indiana COVID-19 county level cases and risk factors. This one, as Michael's pulling that up, I'll just mention that this is one that is really nice because it drills down based on certain risk factors. So you'll see here in the center panel, it says population over 60. So it basically is starting to let you know how coronavirus cases on the left-hand side here, which is the same map as was in their other dashboard. You can compare that to some of these other characteristics that they pull up sort of on the right-hand panel. And if you scroll through that on the bottom, a little arrow. Yeah, right there. They have several different characteristics that are known to be important in terms of health outcomes, such as access to health insurance and that type of thing. And as you might imagine, a lot of these, but not all, are disproportionately concentrated here in Marion County. So this again just gives some more information on that. Yep, and the third POLIS link there, coronavirus neighborhood level risk factors. They did a similar thing here, except for they actually drilled down within Marion County and looked at community level factors, community level poverty indicators and that kind of thing. And rather than go to that, I think that the Reagan Street one was not coming up for me earlier, but maybe that's where I will end sort of showing data, but I've included some other links.
Wow.
Because I don't want to go on too much, but in the Reagan Street one, they do have sort of the comorbidities broken down, like percent with hypertension and diabetes and that.
That's fantastic. So what I'll do is I'll go ahead and get those from the chat, and if you could send those to me, we're happy to pull that into a document and put that on for the folks on the live stream to see, and folks who want to rewatch this broadcast. But thanks, that's great data.
Great. So if we have a minute to just hear from folks, if we have time, or during the breakouts, maybe folks can share that. I guess I would be interested in taking information back from the group about what things have you not seen that you're interested in seeing, that you think really need to be up there and people paying attention to in public health, in clinical care. I mean, you know, my bias is that, or my thought is that, you know, this is a lot of the clinical outcomes, which I think are important, but we're sort of not yet catching up with all of the, you know, socioeconomic and social factors that we know are being impacted by coronavirus, right? I mean, unemployment is at record levels. You know, this is affecting, you know, our entire economy and our lives almost in every way. You know, it's already been mentioned relating to sort of the effects, the isolation effects that are sort of happening throughout the communities and so on. And so if there's ways that we can, you know, demonstrate that and get this in front of sort of the eyes of policymakers, you know, that's at least one way in which at least I try to implement change, and I would love to hear from the group either now or anytime really about what.
It sounds like, I mean, we've got a lot of data. And so here we have, well, we have a shortened window now because we do want to be very attentive to the time. We do want to talk data and you, right? No, please don't mute yourself, because this is the conversation. This is our dialogue time between you and me and Dr. Hicks and Representative Bartlett, if he's still here. We're going to have him to start his video, and that the 5 or 6 of us will dialogue about what can we actually do with this, so that we can perhaps spark some conversation, because in just a minute, our other participants are going to join in breakout rooms. And Dr. Weehy, you'll be in a breakout room. So maybe you'll engage the people in your room around what other kinds of questions can we ask of the data? How can we be intentional to build capacity now that we've been armed with so much information, right? So what do you all think, panelists? That's my first question. How do we increase capacity armed with all of this information? What kinds of things are next? And you should be unmuted.
So we have to do something. Right. My sense right now is that we are all in a mutual admiration society. We may even like each other at this point, right? But we need to take all of the data and all of the potential positioning and influence and stir up as much leadership as we can right now. And there are real things like people that are going to die because they're hungry, which is the biggest health issue of now. And there are, the song said, meager fare. You know, there are folk that need meager fare. There are people that were already hungry, already hurting. The social determinants of their health are certainly compromised before Corona. And so we have to be leaders right now, intra-Corona, and determine how we are going to go at, fueled with all of the wonderful information and data that we've gleaned, to go at something and do something. So food, clothes, technology for kids, you know, those aren't health things, but what are the health?
Are they?
They're resource wraparound holistic health things. Yes. Okay. And so the big thing, I guess, is social isolation. If we wanted to put a big umbrella that makes it a health thing, what can we do with all of this to ensure that not the old people in the nursing homes, but the people in the middle of the block that don't have the ability to drive up to the neighborhood association meetings?
Yeah, so I'm curious because in just a minute, we're going to break out into breakout rooms. And so if you could pose one question to each of the participants from your area of expertise. I don't know why, Dr. Hicks, why it's focused in on you. So I am so sorry.
You know what? I'm equal with everybody else. I'm 1/6 as far as I can tell.
Okay.
And I know we have fun, right?
It's just showing you. So okay, I just want to make sure that I'm not the one seeing just you. But if you could pose one question to the breakout rooms, of course, the Soul Stirrers each have their own set of prompts, but what would you hope to hear in your room if you weren't in that room?
Can I give two? Why we do what we do and what can we do?
Okay, why we do what we do and what can we do?
To specifically help people that are compromised in terms of their health.
Okay.
I have a question.
Sure.
So my question is, what stands out as you look at the changes in people's health and wellness right now? And how does that acute change of the moment reflect a broader issue?
Wow, what a great question. It's almost as if I had asked you beforehand if you wanted to ask that question. But since you did, why don't we take a poll? So when you think about your own health and wellness right now, what is most true about you? And as you are taking that poll, in front of you, we'll ask Dr. Carrie Lawrence and maybe Dr. Sarah Weehee if either of you want to pose a question before we send folks into breakout rooms at about 2:15. We're going to send them away with their Soul Stirrers.
So I think for mine, I think, you know, given the information that Dr. Weehee shared regarding the association with specific other health conditions related in COVID. My question is, like, what other health or social conditions should also we have these strong, like, be able to identify within the data as far as correlations? Knowing, I think a lot of the research that I have focused on for the past couple of years has been around substance use disorder. And so knowing that, like, Black African American men had higher overdose rates in Indiana, like 125% more experienced overdose deaths than any other race or ethnicity. So knowing that that is another kind of very complex social health issue, are there others that need to be captured? I mean, such as with Pastor Hicks talking about the, you know, food access and clothing, having safe housing, all of those other components. What do you see where is maybe some gaps in association?
Yeah, Dr. Lawrence, thank you so much for bringing this dynamic of race into the conversation. Someone in the chat had asked, specifically when we were looking at the COVID-19 related health disparities, specifically, it'd be nice if we knew the age demographic of the deaths in the Black community related to COVID-19. And so as we are breaking out, if any of our experts, if any of our public health professionals, if you can help us by the time we get to the end of our breakout rooms to be able to shed some light on that, or even to point us in the direction to where people can go, because that's something that people are interested in. So I'm going to close the poll on your personal health. So if you've not had a chance to complete that, it looks like 4 of you haven't, but I'm going to close that poll so that we can get to this conversation together, so that we will hear from you. You've been quiet and audibly quiet rather, but you've been chatting it up in the chat box. But now we want to make space for you to have conversations with your peers, with your colleagues, make new friends.
Social justice activities in the church. The church is there to serve, and this is one of the ways that they can serve. I know at Crossroads, one of the things that our pastor does, he's looking to take old homes and neighborhoods and turn them into centers where people can get information that they need. I mean, the church has to can't preach about it and talk about it. They have to take steps to make things happen, you know. If it's mental counseling once a month at the church, or the AAA at the church, I mean, we have to be active. We can't just really talk about what we want to happen. We have to take some action.
That's also very true, Mother Lois, but with this current stay in place, it makes it a little difficult even for the faith communities to reach out.
Not during COVID, of course, but I hope we're not going to be in this state.
You're talking looking into the future, hopefully the near future.
Hopefully.
Yeah. That's good. Dr. Hicks?
Yes.
What can you say that the faith community can offer to helping with some of these issues?
I'm glad you asked. So I think a lot of the things that we're working on right now, that we need to ensure that we are working together as a faith community. And it's vitally important for us to, you know, as I said before, we have to do something, because if we don't do something, then we stay in our separate rooms even more so right now. We have to challenge ourselves to be creative right now, and to not be isolated and in our corners, not doing anything, particularly at a time when the community needs the education that we need to be providing right now. And there are really people that are hungry, and really people that were already hurt and hungry, that could stand our energy moving toward feeding folk, as opposed to what we tend to do sometimes, which is have wonderful discussions about stuff.
Right.
Right. Yes. And so that's my thought. You know, we are feeding, we are clothing, we're doing a technology drive. How could we work with within the interfaith community with You know, around our church, we have 100 churches, most of them small churches with bivocational pastors that are not there all of the time. But how can we work within those churches in the near Northwest? But how can we reach out in an ecumenical way to find the others, to find the unusual suspects that nevertheless can get down with the fact that people are hungry and need food? And we can't do it all, but if we band together as a faith community, I think that provides some leadership. And so if it is technology, or if it is clothing or food or something that's real, that's the thing that creates community, because you can't have community unless you're in a relationship with one another.
I think Dr. Craig really said something though, when he said the challenge of the language of essential.
Yep.
And if you deem that these group of workers are the essential thing to help us all function, you know, we've got to look at the life of the essential, and is it equitable? And is it where it should be to have a healthy life around this whole area of public health? And that allows it, because you're challenging something they labeled already.
Yep. Yeah,
That's good. That's a good thought.
Yeah, so the whole group is now reconvened, and you all are making some excellent points. So I want to thank you each for bringing your voice into the room and not being shy. In the last few minutes that we have remaining together, first, let's give yourselves a round of applause. You made it through. You can click the reaction even if you don't want to unmute yourself, and just clap it up on your screen. That I hope your time was fruitful, was productive. As part of your instructions, you were supposed to have someone to come back and report out from your small group. So the Soul Stirrers, if you would like to take the lead, as people motorcycle by my house, I live in the city. If you want to take the lead and report back from your group, we'll take 60 to 90 seconds to hear back from each group. And I'm going to start with our lead Soul Stirrer, who shows up first on my screen, Michael Jefferson.
Hi all. We had a really, really good conversation, of which you just heard the last few moments of. And the first thing we did was we talked about the social determinants of poor health that are now being exacerbated by this COVID-19 pandemic. And while we came up with, while our original objective was 5, we ended up having a good 8. And I'm happy to read them out for you. So we talked about food deserts. So if you don't have access to good food, you're more likely to get high blood pressure, diabetes, heart disease. If you're in an unsafe housing situation, or you're surrounded by environmental justice issues, those are other social determinants that can get you there, as well as the relationship between mental health issues and economic issues, right? So these are all of these social concerns and conditions that are non-voluntary. Folks don't self-select into them. And then also not just access to good health care, but also the racial disparity of how folks are treated when they get to the healthcare facility. So for instance, many COVID-19 patients of color were sent back home. And then of course that gets down to affordability of healthcare and even access to healthcare coverage. And then we also talked about child welfare and aged populations and their specific vulnerabilities, and how that adds some additional layers, especially when we talk about how social distancing can become social isolation, or isolation from people who can advocate for you. So we think about those teachers who are mandatory reporters, as was mentioned earlier, and even if you're out in public and you're an elder person who's been abused, somebody else can see your bruises and help you out. But there were a couple of other things that came out of as well, how morally, a lot of this is as a result of moral distancing. So pre-existing moral conditions have equal pre-existing social conditions, which have ended up with pre-existing medical conditions. So Dr. Hicks lifted it up well when talking about the treatment of the poor, the sick, and the widowed, and what the work of the ministerium does. But even thinking about if those folks' conditions are not lifted up as moral causes, then downstream they end up with medical conditions that end up with not just an atrophy of the body, but an atrophy of the soul. So that represents, I hope, our conversation well. If there's anything else, feel free to add your voice to the space.
Actually, we're going to ask them not to add their voice to the space because we have one person from each group and you were it. So the next soul stirrer that shows up, again, we're just trying to be attentive to the time. The next soul stirrer that shows up on my screen is Beverly Rogers. If you can unmute yourself.
I think I'm unmuted.
You are.
With a few technical difficulties. So we had this deep conversation. What was interesting is that we went to poverty as being one of the largest problems during this COVID area. And not only poverty with food, we did talk about food, but as far as spiritual and mental and physical, there's a lot that you need to look at when you're talking about poverty. And almost anyone could be poor. Then we looked at the fact that this is so complicated because you have so many groups that you look at. You're going to look at the children. You also look at the seniors, the LGBTQ or whatever acronym, whatever let people, they're all people. And then of course, we have one, and I think it was Tiffany Jackson who's talking about this up because you have so many family members in the same household. So when you're talking about trying to look at all of the issues and the challenges, you can't do it without doing it with a family approach to it. There are a lot of questions. I think we have more questions than we have answers, which is pretty true for this season, and I left them with a question, and I'm hoping we're going to think about that as well.
Well, thanks so much, Ms. Beverly. We noticed your bandwidth is low, and that's okay. We got a good bit of information from you in between the nuggets. So thank you for sharing. And lastly, Quatanya, if you can give your report from your breakout room.
Yes, we talked a lot about how the things that we need to be able to move around in life. One of the resources that were most common, they talked about faith, finance, mental and physical health, how that is important and how we need to have all of those intact in order to become healthy as a people, but also that we should just have that one piece, just like the faith without the financial. So those pieces should go together in fours. Because we need to have that circle, the full circle. Also, there was a question that was posed about the houses of faith, that how do they reach out to those who are somewhat, what we say, unchurched or who do not belong to a congregation? How do we reach out to those people to find out what their needs are? There was another question about how do we support people of color and how are the funds being allocated? So we had a good talk about, I think everybody was pretty open about their personal items, how they feel about their nutrition, faith, and how the faith was the biggest thing that I noticed. The biggest piece was to have the faith to be able to even do the things that we should do to stay healthy, especially during this time and then thus forward.
Well, thank you very much. Faith, finances, and fitness, it sounds like is what your group was talking about. And so thank you for that full report, Quatanya. All of the Soul Stirrers, I want to thank you, as well as our operations assistant, Ms. Diane Murray. I want to thank all of you for the ways that you have really been the heartbeat around how these conversations happened this afternoon. Lots of comments and commendations being given over in the chat room. So we thank you for your comments there as well. I would like to invite at this time, because we've had so much information shared and you may not have felt like your voice had been completely heard. So don't worry. We have a PhD student, one of my classmates in this cohort 2 of the American Studies PhD program at IUPUI, Benjamin Clark, who's going to come with an invitation. And then we got a drawing. Don't go anywhere just yet. Benjamin?
Hello, good afternoon. Thank you, Shonda. I'll just be very brief. Like she said, I'm a PhD student in the American Studies program at IUPUI. I'm working on a research project called the Anthropocene Household. Part of this project is to look at people and how they understand their environments and how they live in their environments. And so my part of the project involves conducting oral history interviews with people, residents and community leaders. We're specifically right now looking at the near northwest side of Indianapolis. That will expand, but right now we're focused on that part of the city. And an oral history interview is a great way to do this and kind of get people's stories and understand their experiences. So I invite you or anyone you know who might be interested in doing something like this. The conversations they're easy to have. It's you telling your story. And they last an hour or two. We're doing them over Zoom now, but we'll do them in person eventually once social distancing comes to an end. So if anyone's interested, you can contact me at my email address, bejclark@iu.edu, or Shonda knows how to get a hold of me too, if you want to contact me that way. So thank you for your time, and I'll answer any questions people have. But again, thank you. It's good to see everyone.
Oh, well, thanks, Benjamin. I thought we had some slides from you, but that's okay. Nevertheless, we've got one more poll and then the drawing, and I promise you, you can venture on from the places you have come from. So you've heard a lot today. You've been given a kind of thoughtful conversation around what does public health look like. We've heard from governance, we've heard from advocacy, we've hopefully given you some information to increase and enhance your capacity, but now maybe you have future interest in doing other things. So you should have a poll in front of you that says, hey, that oral history sounded really cool. How about I participate in that? Say yes if you want to do so. The learning community, it's for clergy people, people who lead houses of worship, and even just for health advocates who are members of churches. Say, hey, I want to be a part of that. And of course, in May, we're going to do another one of these. It's going to be a little bit different, but it'll be the same virtual space. Maybe you want to be there. Or maybe you're like, hey, what's Good to the Soul all about? Or who are you? Just choose other. And I want to be able to say who's saying these things in the poll. I'm going to give you maybe 30 more seconds to finish because there's 7 of you who've not done so. All of the information in the chat, the links, the data, the helpful comments, we will summarize it all and put it in a handy dandy little report, PDF-able, that'll come right to your email in the next couple of days. So because you registered, we already have your email address. And because you're completing and conducting this poll, I'm gonna say, hey, were you one of the 15 people who said, I'd like to be part of the learning community? Click here, if so. We want to make sure that we are doing things that are good to the spirit of universal living. If we can energize your life around human flourishing, that's why we're here. So you've given us data. We want to give you information and position you to be poised to do more for your community. We have had a full time. Thank you for giving us an extra 5 minutes. I really, really hope that you have enjoyed this time. A virtual forum is something we didn't know how we would pull it off, but here we are 2 hours later, and apparently we've done so. So you will receive a post-event survey in your email. We're going to ask that you complete that and let us know how we did. If you loved it, give us thumbs up, but beyond that, talk to your friends in social media. Send out a message, #HealthyMe, #GoodToTheSoul, and tell all your friends how great this experience was. You'll see a video up available for download or review in about 24 hours. We do have to tweak it because some things happen in the middle. We did have our breakout session, so we want to make sure that we clean it up and get a nice clean video up for the world to see. But thank you. You made this event great. So give yourselves a round of applause. And we thank you again for joining us. Any closing thoughts from any of our partners? Otherwise, we're going to say, have a great day. The Lord bless you and the Lord keep you. Until we meet again, keep doing things that are good to the soul. Peace.